Assalamu alaikum. This is Azim Khan Watan here once again with a very important topic in medical billing is Modifier 40 in medical billing. Modifier 40 in medical billing is just related to handicap related. Modifier 40 is an HCPCS Level II modifier defined as handicap related. This modifier is used to indicate that a service or item was provided because of a handicap related condition. It means that the patient having a condition that is totally handicapped, like he is unable to work socially properly, he is unable to attend anything socially. So that in that case, we can use modifier 40 in that case. When to use modifier 40, this modifier is rarely used in standard Medicare and Medicaid or commercial payer billing. It may apply in specific state Medicaid programs or private payer systems where handicap-related conditions are tracked or reimbursed differently. Viewers, if we talk about modifier 40 to use, in a rare case, it's been used in Medicare and Medicaid program, especially in Medicaid case where the disability of the patients in more cases, due to that a patient is unable to walk through a social circle. That's why this kind of modifier is used. You would use modifier 40 when the patient has a documented physical or mental handicap and the service or item was medically necessary due to that handicap, and the payer requires or allows this modifier for documentation or reimbursement. Viewers, if you talk about the modifier 40, in that case there should be a proper documentations which shows the patients having the conditions of handicap, where that medical necessary service required to send claims to the insurance and the insurance reimburse those claims under the guidelines of the payer and allows those modifiers which can be used in the handicap case or in the procedure codes. Here we go with two examples. The first example in handicap related orthotic device. A patient having a child with cerebral palsy, a qualifying handicap, service prescriptions and fitting of ankle foot orthotics to assist with walking. Here is like a patient having the conditions where he is unable to walk, and then the service being provided, the prescriptions and fitting of ankle foot orthotic is required a service to assist with walking. Like he is unable to walk properly, then the service being provided to him like to fit his ankle foot orthotic. Due to that, he can be assessed in walking. So in that case, we can use the modifiers 40, and the CPT code is L1940, is a HCPCS code, ankle foot orthotic, and modifier with that is 40 to indicate it's prescribed due to a handicap. Like in this case, the ankle foot orthotic orthosis is there, but when we use modifier 40, which reflect that this is actually the handicap related. If we come to the explanation, modifier 40 tells the payer that the device is needed because of the child's physical handicap, which may be relevant for approval or tracking. Viewers, if we talk about modifier 40 here, the payers required the device for the patients, like to having walking conditions. Okay, so example number 2, we have handicap related vision services. Patient and adult with intellectual disability who requires a low vision aid service, provisions of magnifying device for reading and functioning use. In this situation, the patient is unable to read properly and he needs some low vision aid in that case. And we comes to submit a claims, to create a claims, we will have a CPT code E0100, low vision magnifier, and when we provide the service to that patient, we provide the vision device to that patient, we will be sending a claim by adding modifier 40 along with CPT code E0100. That is a HCPCS code which we append in the claim and submitting to the proper guidelines with insurance to the insurance company. Okay, so viewers, thanks for watching this lectures. I hope you understand the use of modifier 40 in handicap related situations, And I will request you to subscribe my channel and share with the friends, so to understand most of the medical billing concept on this channel. Thank you so much. Have a wonderful day. Bye bye.